She has been a registered nurse for 30 years and for 25 years has been faculty member at the University of Central Missouri. Dr. Putnam earned her PhD degree in nursing from the University of Missouri. The scope of her research interests includes health policy and issues related to tobacco, cannabis, and the evaluation of health and wellness care provided to vulnerable populations. This is a great presentation.
Good morning. So excited to be here. Let me share with you two thoughts. One is, I am here presenting today for the same reason that Dr. Victoria Proctor shared yesterday in her presentation. I came to ACNA in Albuquerque, and I was like so moved and so inspired that I said that the next conference I was going to present at. So that's why I'm here. And I challenge you that if you want to think now, be inspired while you're inspired. Challenge yourself to present at the next one. So the other thing that I wanted to share is I am so impressed with the depth of your caring and your experience and how you're changing patient lives. It really moves my heart. But I don't do patient care, I do nursing education. So my students are who I care about. And I wanted to share with you in my poster what I took away from the last ACNA and how I use this in the classroom and what our results were. So let me share with you. We all know that cannabis misuse can affect student success. That's been my background. So college students really are high-risk students. They tend to take high-risk behaviors, and cannabis is just one of them. In 2020, SAMS have reported that 34% of college students have used cannabis in the past year. So with our increasing knowledge of cannabis as medicine, we need to educate our students not only to know about cannabis misuse, but also how to use cannabis as medicine. Mm-hmm. So, and what we're finding is that today's healthcare student has much more information than we ever dreamed of having, and they're really getting this from a different perspective. So what I want to do is take the next few minutes and give you a little background, a little review of literature, and then we'll talk about the activities we did. Evie Blad in the Education Weekly discussed changes in student attitudes and increasing patterns of use. The students are gleaning their information from family conversations, school curricula, advocacy, and regulatory efforts. And I personally heard students coming into the classroom bringing this information with them, their own experiences. For example, I have been to a couple of recreational dispensaries in Colorado, California, Oregon, Washington, just a couple. And from what I can tell, they all follow the same rules. And another said, it was very different seeing medical marijuana being processed rather than recreational marijuana that I saw in Denver. So Glad is calling for classroom conversations so that we can start to address some of these thoughts the students are having. Sandy Wolfson in 2000 reported on the presence of the phenomenon of false consensus. And this is the idea of a bias or tendency to overestimate the extent to which others share one one's attitudes and behaviors. So her team, they surveyed 348 college students, and cannabis users, of course, think that other people use cannabis more than the non-users do. Students who have used cannabis may be motivated to overestimate because they use this to justify their own behavior. Behavior can also be influenced by many other things, but they can include selective exposure, compounded by peer pressure, regulation, and tension relief. So what other sources of information are influencing our students' attitudes and perceptions? Lucy Popova in Addiction interviewed 32 Colorado students aged 18 to 26, which is the population that I work with, and who use various cannabis products. The students reported to them their sources of information was bud tenders. Very rarely did they report that healthcare professionals were providing them the information they need. Now, Michael Can in the Journal of Internal Medicine identified a lack of understanding of what the medical students' perceptions are about cannabis. So his team interviewed 624 medical students on their attitudes towards marijuana. They found support for legal reform, support for medical uses, support for increased research. but the students are afraid of side effects, and hence the medical students are hesitant to prescribe cannabis. What Chan called for was more research on this quote-unquote culturally charged topic. So, right now, I am completing the Cannabis Care capstone with my fellow students, and I need to give a shout out because just this week, one of my fellow students had said that I have found with teaching, as soon as I bring up cannabis, everyone in the room is interested in what I have to say. And it's because it's so much a part of what the younger people have grown up with, they really have a different perspective. So what I have identified is the challenge that healthcare faculty are encountering when bringing cannabis care and use education to the classroom is the effect that these misperceptions, that the media influence, that the lack of evidence is having on cannabis care. So we've known that the endocannabinoid system is the key to medicinal cannabis. I was kind of curious how my university was doing with educating our students on the endocannabinoid system. So I teach a senior level drug addiction to recovery course, and I had 50 students, and I asked them, have you ever heard of the endocannabinoid system? And more than 50% had never heard of the ECS. More than 75% reported never having ECS in classes, and more than 80% said they wanted to know more. That was it. They have an interest, and this is, as faculty members, we need to catch that interest and capture that, because that's what we're more effective when we do that. So these results actually align with both Mann's 2021 report and Parmalee's 22 study reporting the lack of nursing education on the topic of cannabis. Okay, so now we're walking into our study. And the instructional design of this exploratory study included 3 assignments. And so I have columns here with assignment 1, 2, and 3 with QR squares, and they give you the instructions that I gave the students, so you'll have an understanding of what the students were asked to do. And basically they had a cannabis-related activity, and then they had to do a written reflection on this activity. And I will point out, the 1 and 2 are just basic instructions, but number 3 is really cool. If you have a chance, this is actually a video. This is my video, and if you go to that QR code, you'll be able to watch that. That's what the students got to see. So, okay. What we did, I had 2 sections of my drug addiction course. I had an N of 42, and these responses were coded thematically and analyzed with my research team, and here are the results. The first job was a campus care job. The student was offered a job as an addiction specialist in a new city. They could go to San Diego, Lincoln, Nebraska, New Orleans, St. Louis, Atlanta. And their responsibilities as this included cannabis education programming and patient advocacy for the local hospitals, schools, clinics, and corporations. I told them to go to the internet. I want you to find some things out to help you decide if this is a good job. What are the policies and regulations surrounding cannabis in that area? What are the known usage rates and disparities? Find out what resources are there. What resources do they have for medical cannabis, for substance use disorder, for mental health? And lastly, find out what you can about the culture and the attitudes in that area about cannabis. So, they were going to write their reflection, and 77% of the students said they would be interested in taking this position. Again, we have the interest. And so when we analyzed this, we came up with themes that reflected the acknowledgement of existing stigmas as well as an awareness that our research is evolving. So, for example, excuse me, one student said, this job may be difficult to fulfill due to the societal acceptance of cannabis in those given areas. However, I do believe now that people can become dependent on cannabis, and that should be prevented. With that being said, I would choose to take the job to prevent cannabis dependence and to educate on what medicinal usage looks like. Giving people the opportunity to learn about how to use cannabis safely may help decrease the occurrence of dependency. Another student said, because Lincoln, Nebraska is a college town, I believe that many of my patients would be open to change and alternatives to traditional medicine. I most likely would still accept the position, But to be honest, I am now beginning to understand how much I really don't know about cannabis. Before I could be a patient advocate and support the use of cannabis, I would need to understand a lot more about how effective cannabis is in the treatment of medical and psychological issues. This leads me to the concept that I believe is most eye-opening to me during this course. I was shocked to learn that many nurses believe in the legitimacy of cannabis as an alternative form of medical treatment. I do not know how traditionally licensed healthcare professionals are involved in the medical marijuana industry, and I really enjoy learning more about this. I'm so excited. I got goosebumps just this is so exciting. Okay, so assignment number 2. For the second assignment, we explored athletes as a vulnerable population and PTSD as a mental health issue. So if you remember back in 2021, U.S. Track and field 100-meter sprinter and relay racer Sha'Carri Richardson was given a month-long suspension from the Olympics after testing positive for THC. I had the students watch CBS News and NBC News, and they saw what Sha'Carri come on and say, "I greatly apologize if I let you guys down," because I know I did. Then the students read the ACNA 2020 position statement, which I actually went to the website just to review to make sure it was still there, and it's under review by the ACNA. And as a former policy officer, this is a great thing. I give kudos to the ACNA to look and make sure what they're doing is current. So that was a big deal for me. And the ACNA had asked organizations such as the World Anti-Doping Agency to update their policies reflecting current science. Evidence supports cannabinoids as effective in the treatment of PTSD. The ACNA called for the nation's governing bodies to acknowledge the importance of the passage of legislation that qualifies PTSD for medicinal cannabis in all states. Students wrote about Richardson's suspension and the ACNA's advocacy efforts regarding policy change for PTSD. And we found we had 3 themes: the ethics for the suspension, the need for more research regarding cannabis and PTSD, and increased awareness of the inconsistencies of drug policies from a global perspective. The first student said, "I can see both sides of this argument. I do not think that testing positive for THC should be something so harshly punished for. THC has medically been proven to help with cases of physical and mental strain. Saying that, I also think she knew the rules and she should not have even considered taking THC without consulting someone first. I disagree with the punishment and the strict THC policies, but they are the rules and she should have considered the consequences." Another student said, "While I agree with the statements that advocate for policy change for medical cannabis, I disagree with efforts of obtaining leniency for Richardson. She knew the rules, and when she decided to break them, regardless of what her reasons were. And as outdated as the rules may be, they still are what they are. If the rule was don't, then just don't do it." Then the third student said, "I love that you want science to be exposed about the benefits of cannabis, but let's not ignore the symptoms. For someone who is coping with death in the family and is a successful athlete, it should be encouraged to stay active, as exercise is a great coping method. There are better ways of coping and dealing with PTSD, especially for someone who is now a role model for many Black individuals. I mention Black individuals because they are the victim of mass incarceration, which predominantly is nonviolent drug offenses such as cannabis use. These policies are affecting more than just athletes. It's affecting the audiences that grow up watching these athletes." Oh, there goes goosebumps again. This is very powerful. That the students are processing and they're sharing what they're thinking. They're not holding back. They really do tell you what they're thinking. So now this is the fun assignment. Assignment number 3. If you have a chance, I'd encourage you to go take a look at that. And please give me some feedback. This is my first time taking a virtual field trip, and this is our virtual field trip. We wanted to promote some knowledge and curiosity about cannabis. So we went to the Sacred Gardens of New Mexico, where we went with ACNA on the last conference. The students reflected with comments and questions about the field trip. Thematic analysis demonstrated that student curiosity across a whole bunch of topics, and that's what the word cloud is there. It's a word cloud of the different topics that they had questions about. And one of the major themes was an interest in cannabis horticulture. So the students said, if I'm being honest, I thought the growing process was just like every other plant. You put the plant in a pot of dirt, you water it, set it in the sun, and leave it be. I never realized how much work goes into the growing process. What goes into getting a license and having a facility like that? What is their hiring process like so that they have trustworthy employees? Is there an odor issue? Since insurance doesn't cover the use of medical cannabis in patients, do they cover growing houses in case something happens there? Another theme was the cannabis industry security. Traveling to New Mexico as a nurse and learning more about medical marijuana would be a trip for the books. I'm glad they take it seriously down there with all the security they use. I was honestly surprised about the measure of high security at the dispensary, but I'm sure this works out for everyone's favor. And lastly, the status of cannabis research for health was the third theme. This student wrote, I didn't realize that there were so many diseases that weed could be used to treat. It does make a lot of sense though. While I choose not to partake, I don't know anybody that doesn't use weed in one way or another. I've asked certain people why they smoke, and I've gotten a lot of different answers. They vary from being one affliction or another to helping keep the users calm. I wonder if it could be used as a treatment for mental health issues. So in summary, the results of these instructional strategies demonstrates that today's healthcare students have a curiosity and concern for their potential role in cannabis care. These three assignments support the need for additional studies on innovative cannabis care teaching strategies that promote the students' intellectual humility and curiosity. The lessons learned from this study have implications for designing nursing curricula that rigorously and creatively engage students in the practice of cannabis care. Thank you.